Hello, today we're here at Children's Medical Center in Dallas, Texas to talk to you about asthma and asthma education. So let's get started with explaining what asthma is. Asthma is a chronic, ongoing disease that affects the lungs. When you have asthma, you have inflammation or swelling of the lining of the airways, and this causes mucus to build inside the air passages. In addition, the muscles around the airway tighten, which causes the airway to narrow, making it harder to breathe. The good news is that this is reversible with medications.
There are two general classes of medications known as controller medications and quick reliever medications. Controller medications help prevent and control the swelling or inflammation that can develop inside your airways. These medications are taken 1 or 2 times every day to help keep asthma under control. When your child's asthma is well controlled, he or she will not have asthma symptoms. This does not mean that his or her asthma has gone away. This means that the controller medication is working. Controller medications will not provide quick relief when you're having trouble breathing. Some examples of controller medicines are Flovent, Advair, and Pulmicort, just to name a few. Quick reliever medications such as albuterol and Xopenex help relieve asthma symptoms by making the muscles around the airways relax. The reliever medication should be kept with you at all times wherever you go. You should use the quick reliever medication as soon as you start to have symptoms to prevent the exercise-induced asthma and anytime you're having difficulty breathing. Remember that all inhaler medications should be used with a valve-holding chamber or spacer for effective delivery of the medication into the airways. For more information on how to use your spacer with your inhaler, ask your healthcare provider or just stay tuned for the next section of this video.
All inhaler medications should be used with a valve-holding chamber or spacer for effective delivery of the medication into the airways. Spacers work with your inhaler to make it easier to get the medicine down into your lungs, but all meter-dose inhalers need to be primed when they are brand new or haven't been used for a while. Speak with your healthcare provider about priming your specific inhaler. Next, I have Wyatt and Michael here to help me demonstrate the correct use of a spacer with your metered-dose inhaler. First, remove the cap from your spacer in your inhaler. Make sure there's nothing inside the mouthpiece. Next, insert the mouthpiece of the inhaler into the opening at the rubber end of the spacer. Now shake the inhaler for 5 seconds. Next, put the spacer in your mouth, form a tight seal with your lips around the mouthpiece, and breathe out. Now press down on the inhaler 1 time. Breathe in through your mouth as slowly and deeply as you can for about 5 seconds. Now hold your breath as you count to 10 and then breathe out. If your healthcare provider wants you to take another puff, wait 1 minute and repeat the steps. When Wyatt was younger, he had to use a mask with his spacer. If your child needs to use a mask with his or her spacer, shake the inhaler for 5 seconds. Place the mask over the nose and mouth, forming a tight seal. Press down on the inhaler and continue to hold the mask over your child's nose and mouth while he or she breathes in for about 6 breaths. Remove the mask from your child's face. If your healthcare provider has prescribed more than 1 puff, wait 1 minute, shake the inhaler, and repeat the steps to take another puff. Remember to clean your spacer and inhaler each week. Pull off the cap from both ends of your spacer, remove the mouthpiece cover, and soak the parts in warm soapy water for 15 minutes. Rinse well with clean water and allow to dry. Put all the parts back together and store in a dry, safe place. Each inhaler has specific cleaning instructions, and it is very important not to get these inhalers wet. Ask your provider for instructions, or you can refer to the instructions that came with your inhaler.
Next, we're going to talk about triggers, which are the things in your environment that can aggravate your asthma, causing it to flare up. It is very important to avoid your triggers for good asthma control. Some of the most common asthma triggers are things like smoke, dust mites, pet dander, pollens, mold, cockroaches, and strong odors from chemicals, perfumes, and colognes. Respiratory infections, changes in the weather, certain medications, and sometimes even exercise could cause your asthma to flare up. If you are unsure of what your asthma triggers are, ask your healthcare provider to help you identify them.
It is also very important to monitor your asthma daily to recognize early warning signs so that you can stop an attack from occurring. Asthma signs may start hours or days before the attack actually begins. Some early warning signs include first signs of a cold or flu, runny, stuffy nose, sneezing, a cough that doesn't seem to go away, waking up at night coughing, mood changes, headaches, stomach ache, needing to clear your throat often, and eczema flaring up. Signs that your asthma is getting worse are increased coughing, wheezing, chest tightness, and difficulty breathing. Danger signs include trouble talking, trouble walking, bluish gray or dusky color to the lips and the nail beds, retractions, increased respiratory rate, fast heartbeat, nostrils flaring when breathing, and your quick reliever medicine doesn't seem to be helping. This is when you need to call 911 and get help fast. Remember, you must avoid all of your asthma triggers and take your medicines exactly as prescribed by your healthcare provider. Here are some helpful tips for remembering your medication names and when to take them. 1. You can take a picture of your quick reliever and controller medicine, if you're prescribed one, with your cell phone. 2. You can get an app for your cell phone that will remind you when to take your medications. 3. You can set visual reminders such as placing your medication next to your toothbrush or on the kitchen table. 4. You can set auditory reminders. Most cell phones have alarm functions that allow you to set a daily time when it rings. 5. Write all of your child's medications on a card and keep it in your wallet. Update it as it is needed. 6. Each time you fill up a refill, make a note on your calendar to order and pick up the next refill 1 week before the medication is due to run out. It is extremely important to never let your child's medications run out. One final reminder, using a written asthma action plan can help you manage your asthma better and provide guidance on how to take the correct action in response to your asthma symptoms and your level of control. It will also help you adjust your medication in response to signs and symptoms of worsening asthma and know when to seek medical care as needed. If you don't have an asthma action plan, be sure to ask your healthcare provider for a written plan. Remember, you can control your asthma and live a normal, active life by avoiding your triggers, taking your medications as prescribed, and working with your healthcare provider to achieve good asthma control. Thank you for watching.